Let us first go to the Ayurvedic system of medicine. So over here, this is the picture or the photograph of Lord Dhanvantari. He is considered to be the god of herbs and surgery. So we'll go to Ayurveda. Ayurveda, it is also called as the Indian system of medicine. So this particular system of medicine, it is very old system, and there is some saying which is associated with this particular system of medicine. Amantaram aksharam nasti, nasti mulam anushadam, ayogyah purusho nasti, yojakah tatra durlabam. This is the saying in Sanskrit because all the information which is available in Ayurveda, it is there in Sanskrit. The meaning of this is there is no syllable without mantric power. There is no person without good qualities. Similarly, there is no root or herb without having any medicinal value. Rare is the one who can discover these powers and put them to good use. That means it is trying to say us that there are so many plant materials which Mother Earth has offered us, and every plant material, it is bound to contain some medicinal properties. It is we who have to identify and discover those medicinal values which are hidden or which are present in the plant material. So there is a lot of potentiality, hidden potentiality available for using plant materials as drugs or medicines. So what is Ayurveda? Ayurveda means science of life. I can split Ayurveda in two words. Ayur, life. Veda means science. So it is science of life. Ayurveda, it is considered to be one of the oldest system of healthcare, dealing both with preventive as well as curative aspects of life in a most comprehensive way. Ayurveda, it is originated in India long back in pre-Vedic period. So it is also called as the Hindu medicinal system. It is called as Indian system of medicine or Hindu medicinal system. So it is a very old system of medicine which is practiced even till date today, and it gives very, very promising results in various diseases. Initially, there were 4 books of spirituality, living and behavior. These 4 books are known as 4 Vedas. These 4 Vedas are Rig Veda, Samveda, Yajurveda and Atharveda. Now, out of these 4 books, Rig Veda and Atharveda, they were written in 5000 year BC. It has got some references and information on health and diseases. The Ayurvedic texts are coming as Charak Samhita, written by Seth Charaka, and Sushrut Samhita, written by Seth Sushrut. They were documented in about 1000 years BC. So Charak Samhita, it is giving information about the medicinal properties of different herbs and plant materials. And Sushrut Samhita, it is giving information on various surgical procedures which were used in those times. As per the Indian heritage and science, Ayurveda, it is considered to be Upaveda. In English, it is an annexure to the 4 main Vedas, that is the knowledge systems. So the famous treatise of Ayurveda is Charak Samhita, written by Seth Charaka, which details about the prevention and treatment of the disease. And the second one is the Sushrut Samhita, written by Seth Sushruta, which deals with various Ayurvedic surgical procedures. So these books are available till now, and you are going to get a lot of information pertaining to plant materials and their application in prevention and treatment of various diseases in Charak Samhita. And all the Ayurvedic surgical procedures, you can read it or you can know it from Sushrut Samhita. Now, what is the basic theory, principle and basic concept of Ayurveda? Now, in universe, everything in universe, it is basically composed of 5 basic elements. These 5 basic elements, they are called as Pancha Mahabhuta. And these 5 basic elements, they are called as space, air, energy, liquid and solid. Now this Pancha Mahabhuta, they exist in our body, that is a human body, in the combined form, and it is called as 3 dosha. Now these 3 dosha, it is considered to be three pillars of the life. That means the three doshas are Vata, Pitta and Kapha. This Vata, it is made up of space and air. Pitta is energy and liquid. Kapha, it is solid and liquid. Now these three dosha, that is Vata, Pitta, Kapha, they exist in human body in 7 different forms. And these 7 forms, they are called as Saptadhatu. These Saptadhatus are Rasa, that is the lymph which is present in our body, Rakta, which is the blood, Meda, that is adipose tissue, Mamsa, that is the flesh, Majja, that is the nervine tissue, Shukra, that is the reproductive tissue, and Asti, that is the bones which are present in our body. Now, these tissues, they are subjected to wear and tear, and Mala, that is the excretory product, is formed. Now, what is the underlying principle of Ayurveda? The underlying principle of Ayurveda is the three dosha, that is Vata, Pitta, Kapha, the Sapta Dhatu, that is the 7 forms existing, and Mala, that is the excretory product. If all of them are in balance or in harmony, the individual is considered to be in a healthy condition. But if at all, if there is an imbalance in either of them, that is three dosha, Saptadhatu and Mala, then there is an imbalance and the patient is suffering from a pathological condition or is suffering from a disease or a disorder. This is the basic underlying principle of Ayurveda. So, Ayurveda, it is the ancient science of life and it is believed to be prevalent for last 5,000 years in India. And the hypothesis is, it is based on Vata, Pitta, Kapha, that is three dosha Siddhanta, Pancha Mahabhuta, and mainly on Sapta Dhatu. Now, it is also said in Ayurveda that if all this, that is what you can call it as three dosha Siddhanta, it is believed that Vata, Pitta, Kapha, if they are in harmony with each other, but in every human being, one of them is dominating, which in turn it is called as Prakruti of that person. So there are some individuals who are going to have Prakruti of Vata, some of them will have Pitta, and some of them will have Kapha. So depending upon the individual, one of them will be more dominating as compared to other two, either Vata, Pitta or Kapha. Now, in addition to it, Ayurveda also states that it is hypothesizing about the 5 characteristics of medicinal herbs. Now, these 5 characters of medicinal herbs are Rasa, Guna, Virya, Vipaka and Prabhava. And these can be applied to treat various pathological conditions. We'll be going into the details about what is Rasa, Guna, Virya, Vipaka, Prabhava. So it is hypothesized that these 5 characters of medicinal plants, that is Rasa, it is a therapeutically active agent. Guna, it is the quality of the plant material. Virya, it is an active principle by which the potency is characterized. Vipaka, it is considered to be the end product of digestion. Prabhava, it is the actual therapeutical activity of the drug in the individual. So, Rasa, Guna, Virya, Vipaka, whatever the therapeutic activity which is exhibited by the active principle, the potency of that active principle and the actual therapeutic activity, all these principles can be applied for treating various pathological conditions or disease conditions in the patients. These are some of the examples of Ayurvedic drugs. To name a few, we have got Amlaki, that is in Sanskrit. Botanical name is Phyllanthus amblica. It is Rasayana or it is an immunomodulator. Then we have got Ashwagandha, that is Vidania somnifera, again an immunomodulator. Guduchi, Tinospora cordifolia, immunomodulator. Curcuma longa is Haldi. It is a very good antimicrobial. Neem, Azadirachta indica, it is anti-diabetic. Shunthi, that is the ginger, what we commonly called it as Adrak, it is anti-emetic. Glycyrrhiza glabra yashti medu, it is anti-ulcer. And Chitrak, that is Plumbago xylenica, it is anti-tumor or anti-cancer. So there are so many drugs which are already identified in Ayurveda, in Charak Samhita, and their usage also is being mentioned.